Hi, this is Dr. Lawrence Janowski of Sonata Laser Aesthetics, and I want to talk to you today about the secrets to a good Botox injection. Botox is a pretty straightforward procedure. Many people love it. It works very well, but I can't tell you how many times I get people coming in telling me about experiences they've had elsewhere where things didn't go well. So if we do these things consistently every time, people are very, very happy with results. And there are a few techniques that I use to make sure that things go very well for people and that people can expect consistent results every time. Botox comes in these little bottles here, and we mix it with saline. And one of the tricks that I use is I like to use something called bacteriostatic saline. It's just a fancy word for a certain type of saline that actually makes it hurt less. So people don't want a painful experience. So by using a certain type of saline that we mix into the bottle, we get less pain, less discomfort. So people appreciate that. The other important thing is I use a very, very small needle. I use an insulin syringe. These are needles that patients typically use to inject themselves with insulin if they're a diabetic. You can see it's a very, very small needle, about the smallest needle that you can buy. So we want a very small needle and special type of saline. So that's the first important point. Now, the next important thing is how much and where, right? So the amount of Botox that we inject depends on the area that we're putting it in and how strong the muscle movement is on the patient. So if we look at the patient here, we always ask the patient to contract their muscles. So make an angry face, so we see muscles contracting here, surprise face, we see the lines coming across here, and smile face right here. Most people will need about 15 to 20 units here, usually about 8 to 10 across the top, and about 10 to 15 on the side. And Jeanette here is probably somewhere in the middle, so we're going to do about 15 here, 10 here, and 10 here for a total of 45 units. Next I'm going to just demonstrate how I inject and the technique that we use to make sure it's consistent and it's done properly. Okay, so I've wiped down the patient with a little bit of alcohol and we're going to inject, and I try to inject consistently every time for just about every patient in terms of the location and the pattern of injection. So in the glabella, which is the area between the brows, there's really three muscles, two on the sides and one in the middle. It's important to get that Botox in a V shape to cover all three muscles. So we make a little pinch here and we put a tiny bit in like that. It's usually about 3 to 5 units per injection. And then we'll put it in the side muscles called the corrugators. And I'm always looking to see if there's any little bit of bleeding. We put a little bit of pressure on that. Not much right now. And the lateral part of the corrugators. You can see it's not uncomfortable, right? Jeanette, you're not feeling hardly anything. It's a very small needle, very, very easy. So that's as simple as a glabellar injection should be. Now, one of the biggest mistakes we find is how people inject the forehead. This is an area that you do not want to over-inject. Typically no more than 5 units on each side is necessary to get this whole forehead relaxed. People who tend to over-inject these forehead muscles can cause a flattening of the brow. People don't like this. It can cause extra skin over the upper eyelids. And so we just want to be very gentle and kind of go across the forehead with very small amounts and usually towards the upper part of the forehead. So make a surprise face and relax. And so we keep our injections very minimal here. 3 across each side. Shouldn't take more than a few seconds. And raise up high again and relax. The other mistake we don't want to make is injecting too far out to the sides, because again that will suppress the brow. We don't want that. And that's the forehead injection. You can see that was really easy. And then the crow's feet is the third injection area. And one of the tricks to the crow's feet, let's turn you a little bit this way, you might want to come around, is that we do not need to inject deep in the crow's feet. You can actually just get right under the skin. There's a lot of little blood vessels around the crow's feet, so we want to avoid bruising if we can. And the way we do that is we just inject just a little bit under the skin without injecting deep, because the Botox actually will migrate down to the muscle without us having to inject directly into the muscle. People don't realize that. So I will usually do about 4 injections per side, and in Jeanette's case we're doing a total of 10 units on each side. If we do see a little bit of bleeding, we just immediately hold pressure, which is another important key. Bleeding can occur, but as long as you hold that pressure, it's very unlikely that anyone's going to bruise in that area. So we'll just hold that, and we'll do one more here. There we go. And once again, it should not be an uncomfortable experience for the patient. Some patients might need ice. Most patients don't need any ice or any preparation. They can use some ice afterwards if they want, but usually it's not necessary. And we'll come around and we'll do the last few here. Again, pinching a little bit of skin, tiny injection just below the skin. 1, 2, 3, and 4. And these little bumps will be gone in 30 minutes after the injection. So we just hold and that's it. So that's really all there is to it. It's a very simple, straightforward procedure. But using these special techniques, I find that we have great success and very consistent results.